Hi, Dr. Yass here. In this video, I wanted to try to explain the unique aspects of the Yass method and why the method is so completely different from every other type of mechanism that's out there designed or promoted to diagnose and treat your pain. And I think that these issues are so significant that they need to be pointed out so that when you are trying to seek a mechanism to identify and treat your pain, especially if you've gone the standard path that the medical system promotes, which is to get an MRI and treat whatever the MRI shows as a structural abnormality, and that's failed. And now you're out Googling on the internet looking for an alternative. I want to be able to pinpoint the aspects of the Yass method that make it so unique that you'll recognize it to be the only true mechanism to properly diagnose and treat your pain. So, here are some of the key features, and hopefully you'll see how unique they actually are. So, number one, diagnostics through the interpretation of the body's presentation of symptoms versus the baseless use of the MRI. This is something I've consistently talked about, and that is that the MRI is theoretically, clinically, and scientifically baseless. It uses correlative theory, which is junk science, to simply say that since a structural variation like a herniated disc is found at the time of your pain, it is the cause of your pain. That is baseless nonsense. From a clinical perspective, in 30 years of doing this, I have found that in more than 99% of cases, that the symptom being presented where the person is actually experiencing their symptom is not where it should be. If an identified structural variation is to elicit pain. So if someone says a herniated disc is causing your pain, the herniated disc causes pain in a specific area. If your pain isn't in that area, then the disc can't be causing the pain. And as I've said, for 99% of cases, the people that I've treated, the presentation of their symptoms was not where it should be if the identified structural variation on the MRI was to elicit pain. And then just this unlimited evidence from studies on MRIs, obviously the failures of the existing system to treat. There's 130 million Americans suffering from chronic pain, roughly 1 billion people worldwide. So clearly, you need a different approach to identifying what tissue is in distress. There is a recognition all the way back to the days of Hippocrates that specific tissues create specific symptoms, and therefore the way to interpret or identify the tissue in distress is to interpret the symptoms. So the symptoms that are quite specific and are being elicited and produced by the tissue in distress need to be evaluated to identify that tissue. That is at the base of the Yass method diagnostic model. Number two, seeing the person as a whole and understanding the cause of pain from other than where the pain is being experienced. So if you look at the existing medical system, if you have pain at your elbow, they do an x-ray or MRI of your elbow. You have pain at your knee, they do it there. They literally stick their nose right at the point of pain and say, okay, let's try to find the tissue in distress eliciting that pain. Well, I can tell you that more than 99.999% of people I've treated over these 30 years, the cause of the pain was not where the pain was being experienced. So any attempt to look at exactly where the pain is being presented is basically leading to a misdiagnosis. Okay? So you need to see the person as a whole. They're living in the world of gravity, they're trying to function. And as a result of that, the body works as a chain. And where the symptom is being experienced in almost all cases is not where the chain began to break down. It is somewhere else. So you need to see the person as a whole. Number three, an understanding of the chronic pain epidemic and what has led to most pain. This is not any part of the medical establishment. The medical establishment, if you asked anybody, why has there been a chronic pain epidemic since the mid 1980s? Nobody can answer that. And that's because they've never been forced to, because they're allowed to perpetuate their false premise and continue to do so until it's stopped. Well, I wasn't going to treat anybody, and the Yass method wasn't going to work until we could understand what was the core principles behind the fact that there was never a chronic pain epidemic prior to the mid to late 1980s. And so we had to understand that if you're ever going to understand why are all these people suffering from chronic pain. Well, the answer is the advent of technology, automation, computers, and phones led people to simply use their bodies less to do activity, their job, recreational activities. Everything that is being done now has shifted to a electronically based mechanism, and as a result, if you don't use your muscles, they weaken. Then when you do try to use them, if they're not strong enough because of the force requirement pushing against gravity to do the activity, you're going to strain and elicit pain. This is the reason why prior to the mid to late 1980s, the only population really suffering with any sense of constant chronic pain were the elderly who had retired. All of a sudden, from the mid 1980s to mid to late 1980s, all of a sudden you have people all the way down to the teens and 20s suffering with chronic pain. That's your answer. And until you recognize what the rationale is behind the entire chronic pain epidemic, you're never going to be able to address anyone who's suffering within the chronic pain epidemic. Number 4, the recognition that most pain is muscular in nature and can be seen with symptoms such as altered posture and movement patterns along with pain. So this goes along with that last point, which is that it is irrefutable that the majority of people, more than 98% of people suffering with chronic pain, have muscular deficits creating that symptom. Now, you could say, okay, so you just said that. Why should I believe you versus somebody else? And the answer is because beyond the actual pain itself, muscle is responsible for posture and movement patterns. And what I've been able to show is, along with wherever that pain is being experienced, there are correlative changes in posture, an altered hip height, a severe arching of the lower back, one shoulder higher than the other, forward head posture. And what you see is that these are going along at the time of the pain. There could be limping, altered shoulder function, the way the joint moves, the way the shoulder elevates when the arm's raised versus normal. That shows that there are even altered movement patterns at the time of the pain, and the medical establishment ignores these connections. The connection between the pain and altered movement or altered posture. The Yass method recognizes that these are clear indicators of which muscles are responsible for the pain itself and incorporates an understanding of altered posture and movement pattern in the diagnostic process. So once you recognize that in most cases the pain is muscular, understanding which particular muscles can be assisted by interpreting altered movement patterns and altered posture. Number 5, a recognition that treatment can never be provided unless the tissue in distress is identified first, so the right treatment is provided the first time. Everybody is out there. Once they have a failed treatment through the medical establishment and they start seeking alternative cares, they simply are willing to accept treatment. And the practitioner is willing to provide treatment, just arbitrarily. Oh, this is what I do. Maybe it'll work, maybe it won't, but you'll give me the money, and at the end, we'll see if it worked or not. That's not a scientific model for providing treatment, and I find it disgraceful and sad that anyone would be willing to simply provide a treatment without being able and responsible for presenting an understanding as to how they know that the tissue that they plan on treating is the tissue presenting the symptoms, and that's not part of anything. How many times have I treated someone who's gone to a chiropractor or a physical therapist or somebody else, and I say, so were you evaluated? And they say, no, they just did treatment, and that was it. As the person in pain, it is your responsibility. It's your obligation to make sure that someone who's going to provide something to you has to be able to at least give some generalized understanding as to how they know that that treatment's going to work. And the way to understand that is to say that these symptoms that you're presenting with indicate to them that this is the tissue creating them, and this treatment is going to resolve the distress of that tissue. If you can't get that from somebody, I don't have any idea how you could be willing to accept the treatment from them. That's never going to happen with the Yass method. There isn't a person that isn't treated through this method that doesn't get a thorough evaluation. And at the end of the evaluation, a narrative is provided to the individual as to the full understanding as to the fact that it has been shown that the cause of pain is muscular and which particular muscles are responsible. That is the only time then that treatment, including maybe massage and stretching, and then the progressive resistance isolated strength exercises are performed. Don't ever accept the treatment unless the rationale for the treatment is provided first. I think that's an injustice, and I don't know how anyone's willing to accept that. 6, a recognition that when the cause is muscular, that only targeted progressive resistance strength training can resolve the cause. And here you have all the people with the magical fascia treatments and the infrared lights and the ozone and the massage and the stretches and all the crap that's out there that supposedly is doing something to muscle. I mean, it's just pure nonsense. The reason a muscle strains is because you live in a gravitational environment. There's a force requirement pushing down on you to perform your activity. Either the muscle has the force output that is equal to or greater than that force requirement, that force of gravity, or you're going to strain and it's going to elicit pain. End of story. So the reason most people are having pain is because there's a force deficit between the force requirement of gravity and doing an activity versus the force output of the muscles pushing up against the force requirement. If you simply at some point are able to strengthen all the appropriate muscles responsible for the activity that's eliciting pain, and you get their force outputs to be greater than the force requirement, you'll be pain-free and fully functional. So please don't accept any nonsensical crap. Listen, if you have gotten to the point where you have weakened, you can't possibly think that you're going to resolve your symptoms by anything other than what? Getting stronger, right? You're going to have to put effort into this. So please recognize you're going to have to be a major part of your rehabilitation, of your ability to resolve your symptoms and become pain-free and fully functional. Okay. 7, a recognition that people are comprised of a physical, mental, and spiritual component, and all three must be working properly for anyone to be working properly. And this is something that really has become a part of my understanding since my personal enlightenment. And that is when I'm looking at people and addressing their pain, I'm also trying to get a feeling of, are there emotional or spiritual connections to the pain that have developed? And it's not so much to the pain, it's actually to the inability of resolving the pain. So all the types of negative emotions that develop, anxiety, hopelessness, frustration, anger, eventually, unfortunately, for many, suicide, all of these develop not because the person has pain, but because they've gone through a process and some level of attempts to resolve their pain, and they simply haven't. And that's what drives this. Now, I think it's important that a person be looked at on those three planes. And if there is a mental and spiritual component, I think that needs to be addressed. And we do address that as part of the treatment. And I think that the only way for a person to be whole is when their physical, mental, and spiritual components are all balanced and in harmony. So I don't think most practitioners are looking at you from that type of point of view, but that is a component of the Yass method. Finally, the Yass method works with you through the whole process, guiding you, encouraging you, and educating you on how to take control of your pain and both resolving it and preventing it from reoccurring. And this is just a point that this is a partnership. There is an absolute understanding that if you have muscular deficits creating your symptoms, you're going to have to be guided, motivated, and educated through the process. So there's always a go between, even in between the sessions that are being performed, emails, texts, Sending of videos is a part of the method so that you can feel comfortable that there is oversight throughout the entire process until you finally take control of the pain and either fully resolve it and be able to prevent it from reoccur, or we get to the point where it looks like you're going to reach that point and you feel that you are at the point where you no longer need that supervision. So recognize that this is a continuous process and that the Yass method is there with you throughout it until you reach the point of having the confidence to be pain free and fully functional and recognizing that that ability is within your power. So hopefully you find this video helpful. If you do, give it a thumbs up. If you like my YouTube channel, Dr. Mitchell Yass, please subscribe and click the bell icon to get notifications when new videos are added or when I'm live on YouTube. If you want to email me, you could do so at drmitch@mitchellyass.com. If you think this is a valuable tool for you and you'd like to actually schedule a Yass Method session, you could do so by going to my website, livewithoutpains.com. You just click on the Schedule Now button, and you'll be given two options, either an in-person session in Jacksonville, Florida, or a Zoom session, which could be had anywhere around the world. You simply pick the day and time that works for you, and we'll be set. So for now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye for now.